Dr. Shabina Asad Qayyum on the airwaves tonight on your local Islamic radio station, Salaam Radio on 106.2 FM. It's been an absolute pleasure to come back. I know I say that all the time, but I really do mean it, because I have missed speaking to you, all of you actually. And I'll let you in on a little secret. Over the last 2 weeks, I've been out and about quite a lot in the city for various reasons. And it has been heartening that the majority of people that I have met have said one thing to me that means so much, that drew me back this week. And what they said to me was, "Oh, your voice sounds familiar. Are you the same doctor who comes on the radio?" And I said, "Yes, it's me." And it meant so much to me. And they appreciated the local radio station, Salaam Radio. We were given a lot of acknowledgement about the work that's done. And it was so heartening to hear that I couldn't have missed this opportunity to come on the airwaves again and to speak to you all about a very important topic yet again. And it's the reason why it's worth it is because I have listeners like you, like all of you, who give me so much acknowledgement. And I want to come every week, and inshallah I won't let you down. So today we're going to do a very special show. You may remember in the beginning of Ramadan, I gave you a show and I conducted a show on diabetes, and I'd given quite a few talks on diabetes and health in the various mosques in the city and also here in the community centres. I thoroughly enjoyed it, and I thoroughly enjoy what I do, honestly. For those of you who are tuning in for the first time, my name's Dr. Shabina Asad Qayyum. I'm a local GP, a medical director. I'm a safeguarding lead of my practice, my wonderful practice that has wonderful patients who I all have a very good professional relationship with. And there's a lot that I do in the way of my work to try and bring to you the most latest updated information in regards to health. Now, if you'd like to participate on this show, it would be absolutely wonderful if you could text and WhatsApp us on 07745 278 978, or you could ring on the studio telephone number on 01733 602 133. You can, of course, watch us on Facebook Live. We also do a stint on YouTube Live, and we are also on Twitter as well. And over the last couple of weeks, I have indeed been sharing and watching a lot of the shows that we've had, and it's been an extremely busy Ramadan. We've had some fantastic fundraising opportunities and events that have taken place over this month, and I'd really like to thank you all for showing your generosity, as the city of Peterborough always does and the Muslim community does. So I'm very grateful to all of you. Thank you very much for your generosity and helping those in this month who are less privileged than us. And it's the month of giving, it's the month of forgiveness, it's the month of compassion. And it's the most important day, Jumatul Wida, and I'm sure, like myself, many of you must feel a tug at the heartstrings, because it's a sign that this beloved month of Ramadan is now leaving us, and we will have to wait to see it another year. So I really do hope that you've made the most of this month, and you have adhered to your fast, your ibadah, and that Allah subhanahu wa ta'ala grants all of your prayers and du'as as well. So before I actually embark upon my show, I'd like to give a shout out to a few people. The first shout out I'd like to give is to a very special brother who has a very special name. The reason why he's got a very special name is because both my sons make up his one name. So his name is Brother Muhammad Abdullah. My youngest son is called Muhammad. My eldest son is called Abdullah. And the reason why I'd like to give this brother a shout out is because throughout he has supported me in such a positive way. And it's made a huge difference to the way I see and think about things. And really, there are some beautiful brothers and sisters that live in our city that contribute very little bit. And we all know that even smiling towards someone is a form of charity. And this brother possesses such a beautiful heart, and I'd like to thank him publicly. And please, all of you, make dua for him, because he's such an amazing individual and brother. So thank you very much for that, and for supporting me, and for supporting me in an emotional way as well. I'm very lucky and very fortunate to have brothers and sisters like you all. And the second shout out that I would like to give is to a sister, Sumaya, who is admitted at Addenbrooke's Hospital with meningitis. She's very poorly. She's a young sister in the community in Peterborough, and I'd really like us, this Jumatul Wida, to put our hands together and make dua for her shifa, and so that she comes back quickly to her family in full health, and that she is able to recover from her illness as quickly and as swiftly and in the best way, with Allah subhanahu wa ta'ala's barakah, as soon as possible. So please bring your hands together at this wonderful special hour just before the opening of the fast to pray for Sister Sumayya's shifa. Thank you very much. Now, what is it that we were going to talk about today? I always do think that sometimes a lot of the topics that I bring up are a repetition of what I've spoken about in the past. But there's a reason behind that. And the reason behind that is that I have more than 3,000 contacts on my social media pages. And a lot of them talk to me to gain advice about various issues. A lot of it's chronic health related. And on the basis of the help that is sought from me, I take those problems into account and then develop a plan as to what my next show should be. And over the last 4 weeks, I have considerably noted that people have in particular been speaking about emotional health and well-being, especially during the month of Ramadan. And I think it's important to talk about emotional health and well-being because we're all affected by it. We're all affected to some degree by stress. And statistics are showing that stress is becoming more and more prevalent as the days go on. Therefore, it's extremely important to recognize stress, to recognize the symptoms of depression, and to recognize what we can do to try and combat those symptoms. So let's talk a little bit about that, and then hopefully during the end of the show I'll be able to tell you a little bit about the services that are very little known or aren't spoken about enough within the city of Peterborough and Cambridgeshire. And the reason why I want to do that is often we have bog standard services that have enormous waiting times, and it's important to know what resources are available, and this show is part of that, to tell you what resources are available for patients or for people who think that they're suffering from a mental health problem. Now, I can't fit in the whole of mental health in one show. It's going to have to be over a couple of shows. However, I'm going to speak about today the most common mental health illness of depression, which incorporates stress. At times it can be mixed with anxiety, and anxiety and depression are two different things, may I hasten to add. And it's very common as well. Depression is very common, and for those people who are listening who suffer from depression, you will know that your day-to-day life can become very distressing indeed if it's not kept in check. And treatments, including talking therapies and medications, can sometimes be resorted to. And treatments obviously take time to work, but there are some good chances of success, and that's something that hopefully we should be covering today as well. And sometimes there are some people who require a long-term cycle of treatment so that their symptoms can disappear. Now, I've always spoken about this before, and I always speak about the fact that the word depressed is a very common everyday word. There are many people that you may come across who say, I actually feel depressed. And I think that it's really important to try and ascertain what that individual's perception of depression is, because it could be that they are suffering from something else or an underlying emotional problem, and it's important that we take that into consideration, and we're able to signpost that individual to the correct service or resource, especially as general practitioners, and this is something that we do all the time. So I think it's really important to try and ascertain what a person is feeling. So for example, if somebody says I'm depressed, when in fact they mean I'm actually fed up because I've lost my job, or I'm depressed because I didn't do my exam very well. I'm not saying that they wouldn't actually be suffering from depression, but this could be as a result of what we call acute stress as opposed to depression. So depression is a long-standing signs and symptoms that are elicited the way a person feels over a number of weeks or even months before they recognize that they need help. And it's important to try and differentiate that. And sometimes, if you do find that you're suffering from depression, you can have such severe symptoms that they are enough to interfere with your normal day-to-day activities. So, extremely important indeed. Now, the stats with depression are again quite phenomenally high. About 5 in 100 adults have depression every year, and that ranges from mild depression to depression that lasts for a few weeks. However, an episode of depression that is serious enough to require treatment occurs, and this is where the statistics are a bit eye-opening for you, occurs in about 1 in 4 women and 1 in 10 men at some point in their lives. So that means if there were 4 women sat in this room right now, one of us would definitely be suffering from depression at some point in our lives that would require medication. And in the same way, 1 in 10 men. So it matters, and it is relevant, and it should be spoken about even more. Now, what are the symptoms of depression? Let's make it simple for all of you, shall we? So, if you have persistent sadness or low mood, this may be without crying or even crying sometimes, then that could mean you are depressed. So if it's persistent over a couple of weeks, 2 to 3 weeks, where you're persistently sad and you have low mood, irrespective of whether you cry or not. Also, if you've had a significant loss of pleasure in taking part in activities that you usually used to take part in and that you normally enjoyed, this could also signal that there is something wrong with your emotional well-being. There are common symptoms associated with depression. So there are those that have disturbed sleep compared with your own usual pattern, and it might be difficult in getting off to sleep or waking early and being unable to get back to sleep as well. Or you could be the other way around. You could be sleeping too much. Some people describe a change in appetite, and often it's seen with those people that suffer from depression, they suffer from a poor appetite. They can't eat as much as they would like to, and then they may undergo weight loss. Sometimes the reverse happens, where they eat in excessive amounts and weight gain takes place as well, something known as comfort eating. Individuals suffering from depression can suffer from tiredness and fatigue as well, which is something that can be very draining, because they often say that if you're emotionally drained, you can feel physically drained as well, and that is one of the impacts of depression on you. You can be increasingly agitated, or you can increasingly feel irritable. Your thresholds can be low. People will say something to you and you'll automatically, under normal circumstances, if the general population think, well, actually, that's not something to be worried about or to react to. But if you find that you're doing that, then it could mean that you have an underlying emotional problem, such as depression. Depression can also affect your concentration, the inability to focus, think of things, set your mind to doing tasks or work on a daily basis. You can find it difficult to sometimes read or function at your place of work, or even doing simple tasks like writing an email can seem difficult and arduous. People who also suffer from depression feel worthless about themselves and feel that they have been a failure and that they're not good enough. This is one of the cardinal symptoms, and sometimes when I ask my patients, do you ever feel worthless? I really do err on the side of caution, because often when you ask that question, for those that are quite deeply depressed, can initiate tears or being tearful and emotional. And it's really important that how you approach such patients, how you approach such individuals has to be done with empathy and compassion. So speaking to somebody and asking them, and I do this all the time with my patients, listeners, rather than asking them, do you feel worthless? Because I know what's coming, I usually say to them, how do you feel about yourself? How do you feel about what your worth is? And if they say to me, well, no, I don't feel great about myself at all, that's often enough to tell me that that person needs help and intervention. And some of the really serious signs are having recurrent thoughts of death or dying, and thinking that the world would be a much better place if I wasn't around, and not having a fear of death, and being preoccupied with death and dying, and talking about it a lot, or sometimes not talking about it at all, and being absolutely quiet about it, but having a persistent, morbid feeling of not being here, is something that patients with severe depression can feel. And sometimes, and this is me just giving you advice about loved ones, there are other ways in which people can manifest that they don't want to live anymore, in the way of feeling suicidal. They may say, oh, I wish I could go to sleep and not wake up, or I hope I never wake up again in the morning, or oh, I'd rather just stay sleeping and never be woken up again. These are signs to take seriously, because the individual may be depressed. So I would urge you all that if you have a relative who says these things, it could mean that they are depressed, and it would be good to have a chat with them to expand on how they're feeling. Now, spoken quite a bit about the symptoms and signs, but if you have those symptoms and they are significantly impairing your normal functioning, such as affecting your work performance, like I've said, and that they've lasted for, say, on average of 2 weeks or even longer, and the symptoms aren't a medication side effect, because do remember, there are some individuals that take lots of medication, and also it can be the side effect of drug and alcohol misuse. So this is where it all ties in, that drug abuse can also cause depression. Alcohol abuse can also cause a depression. So it's very important to ascertain whether an individual who is suffering from the symptoms that I've just illustrated states that actually they may be drinking just for comfort, which isn't relevant to our religion, but there are some taboo issues within the community that need to be addressed, and drugs is one of them. And often you will see young people with mental health disorders who take drugs and find themselves embroiled within a vicious circle whereby they cannot leave that vice. And often drug taking takes place because they want to feel numb. And I see this in a lot of homeless people as well in the city, that a lot of them are involved in taking illicit drugs because they want to numb their emotions so that they don't feel anything. And it's quite normal for them. And those individuals often need a lot of work done to them as well. Now, A lot of people who are depressed will say that their symptoms are worse first thing every day. And it's common to develop physical symptoms when you're depressed as well, such as headaches, palpitations. You can have a thumping heart. You can have general aches and pains, because when you're emotionally drained, you physically feel drained as well. It's only natural. And some people with extremely severe depression also develop delusions, which are hearing things or seeing things that aren't there, and hallucinations as well. Now, these are called psychotic symptoms. And if you have a relative or a loved one who's suffering from depression otherwise and starts telling you that they're speaking to somebody, or somebody who's speaking to them, or hearing voices, or seeing images of things that aren't really there, then that is a sign of serious illness, and emergency medical attention needs to be given to those individuals. So don't ignore that aspect at all. Now, sometimes what can happen is, with such psychotic symptoms, people can feel that they are, somebody is conspiring to kill them as well. And these can be what you call grandiose delusions, which are perceptions that somebody is going to kill them. And again, a sign of serious mental illness that needs to be addressed and brought to the attention of a physician or a GP, so that they can be signposted to the correct specialist treatment and advice. So sometimes people ask, why am I depressed? Why am I depressed? Now, the exact cause isn't known. Anyone can develop depression. Some are more prone to it, and some can develop it for no apparent reason. And you might not have any particular problem or worry, but symptoms can develop quite suddenly as well in some people. And although there hasn't been much research on this, there are some suggestions that genetics could be involved as well. And an episode of depression could also be triggered by a life event, such as a relationship problem, for example, or losing a job, or redundancy, or maybe it's a mixture of all of those factors. So this could also lead to or spiral down into depression. And women tend to develop depression more than men. And it's common for women to become depressed after childbirth as well, which is known as postnatal depression, and also the menopause. Now, sometimes what can happen is that depression can also be associated with medical problems, which I want to tell you about just before the break. And an underactive thyroid gland, so if you've got a low thyroid or an underactive thyroid, that can make you feel quite low, weepy and depressed. Also tired, because you've got the physical symptoms as well. A blood test can confirm this, to get that done with your GP. If you found that you're otherwise all right, but actually you feel a bit slow, you can't focus, you can't concentrate, you're feeling a little bit more cold than usual, your skin is dry, then perhaps you need a blood test to check whether your thyroid levels are normal. Sometimes you can have, there's a little gland in the brain that's known as the pituitary gland, and it can make various hormones that have various actions. And sometimes when you have a decrease of releasing those hormones, you can often find that you would suffer from depression if there is an imbalance of those hormones released by the pituitary gland. And head injury can cause damage to the pituitary gland as well. Head injuries, again, is a physical reason of developing depression. So if you've had a mild head injury, for example, even many years ago, there are medical studies that have shown that the rates of suicide are more common on average in people who have previously had a head injury. And the reason for this, we don't really know. However, it could be due to the pituitary gland being suppressed. And I can see that many people have come on board. It's wonderful to see all of you. And please stay tuned. And also other illnesses as well, like polymyalgia rheumatica, early dementia. I always see people who have dementia nearly always suffer from some type of depression alongside that, because dementia is a really cruel illness. And that's one of the things that can cause depression as well in the elderly. It can be quite tricky to treat as well. There are medicines. So, for example, like we've just spoken about, illicit drugs. They can cause depression too. And what we're going to do is, after the break, we're going to speak a little bit about the treatment for depression. But until then, we're going to go to a break. When we come back, I'm going to speak about a special brother who has been mentioned in the news, and we're going to make dua for him before I proceed to the next bit of the show. So I want you to stay tuned. It'll be lovely to have your company, and time is flying like it always does on my show. It's not fair, but hopefully I'll be here. So tune back to Salaam Radio.
Stay tuned to Salaam Radio after this short ad break.
Where there is extreme poverty, there are always orphaned and abandoned children. Every 2.2 seconds, a child loses a parent somewhere in the world. There are over 200 million orphaned children worldwide. Muslim Global Relief provides education to help orphan children develop the skills they need, making positive changes in their life and breaking them free from poverty. Awarded the UK's Best Muslim Charity of the Year. Make a 100% zakat donation. Visit muslimglobalrelief.org.
If you're looking for a competitive insurance quotation and excellent service, then look no further. At Covershaw Peterborough, our staff has extensive local knowledge and offer you friendly advice. We guarantee to beat any written quote. We offer specialist insurance solutions, taxi and commercial vehicle insurance, public and employers liability, shops, offices and restaurants, courier insurance, fast food car insurance and fleet insurance for 2 or more vehicles, motor trade policies, household and buy-to-let insurance. Covershaw has been trading for 40 years and is a true community insurance broker. Call for a quote on 01733 750 850. Covershaw, for all your insurance needs. Ramadan Mubarak from K2 Care. Do you have a loved one that is in need of care? Or are you a caring person looking for a rewarding job? K2 Care provide an excellent service of quality care with professional, dedicated and compassionate staff, all in the comfort of your own home. We deliver a service to encourage independence while maintaining the highest levels of dignity and privacy. K2 Care also specialise in caring for ethnic minorities. Contact K2 Care on 01733 55 52 61 or pop in at 805 Lincoln Road, PE1 3HG.
हाँ जी जनाब, आज तुसने किया 12 बजे
जनाब फैमिली की बाहर खड़ना चढ़ाया खिलौने पिलौने से सोचना कुत्ते जाओ
इस परेशानी वाली कड़ी गल है। इब्राहिमी बफे रेस्टोरेंट पर जाओ, उतना फ्री पार्क करो। उन्होंने मजेदार ते स्वादले पाकिस्तानी, इंडियन, चाइनीज ते इटालियन आया खाने ना ते जोड़ी कोई नहीं, नाले सस्ते ते स्वादले।
इसका मतलब है बटवा भी नहीं होला होने का। इब्राहिमी बफे रेस्टोरेंट वैरायटी ऑफ डिलीशियस डिशेस के अलावा जेलाटो आइसक्रीम एंड वॉफल्स भी करते हैं। वीकेंड्स पर अपना टेबल बुक करवाइए और वीकडेज तशरीफ ले आइए। ओपनिंग आवर्स शाम 5 बजे से रात 10:30 बजे तक। इब्राहिमी रेस्टोरेंट 63 Sycamore Avenue, Peterborough, PE1 4JP. टेलीफोन 01733 313131।
कश्मीर आर्फन रिलीफ ट्रस्ट मीरपुर से बुशरा खानम का पैगाम।
मेरा नाम बुशरा है और कोट मेरा घर है। कोट में मुझ जैसे बहुत से यतीम और नादार बच्चे रहते हैं, जहां आपके तावन और मदद से हमारी तमाम तर जरूरतों का खास ख्याल रखा जाता है, जबकि हमारे रोजमर्रा के तमाम तर अखराजात के लिए आपकी मजीद मदद दरकार है। इस रमजान मुबारक में अपने अतियात, सदकात और ज़कात कोट को दीजिए और हमारा सहारा बने।
For your support and donations, quote UK office 0300 123 774.
Bismillah. قال النبي صلى الله عليه وسلم الدعاء مخ العبادة. The supplication is the essence of worship.
Peterborough's community radio station, Salaam Radio, 106.2 FM.
Assalamu alaikum and welcome back to the Body, Health and Mind Show with Dr. Shabina Asad-Kiyum, your local GP of Peterborough and your long-standing radio GP as well on the Body, Health and Mind Show. You know, I often see myself with this show up until retirement. I think that would be okay, won't it? But the Qasim will get fed up with me. Oh, but there he is. He's dedicated to this station just as much as I am, and the rest of our presenters are, who do an absolutely wonderful job. Now, before I proceed to speak to you a little bit about the treatments with regards to depression, I really do, again, want to begin in this show with giving a shout out to a brother who was subject to a hit and run outside the mosque yesterday in Leicester after Taraweeh, and his very good friend Brother Qasim Muhammad, who listens to the show on a very regular basis and also asks questions, lives within the city of Peterborough, has asked us please all to put our hands together for Brother Muhammad Mazumi Muhammad, who lives who has been subjected to this hit and run in Leicester. I'll just see the name is confirmed as Mazumi Muhammad, and he is in intensive care at this moment in time. He is critical. Brothers and sisters, let's all come together and make dua for our wonderful brother and pray that Allah subhanahu wa ta'ala give him shifa on this Jumatul Wida. Please, let's put our hands together and make dua for him and make sure that he recovers quickly and comes back to his family as soon as is possible, and that all of our brothers and sisters are protected during this month of peace during Ramadan, so that all members of the Muslim Ummah who are unwell in hospital can spend and see Eid with their family. So please bring your hands together and pray for Brother Mazumi Muhammad, who is in intensive care. Jazakallah. Now, moving on, talking about treatment options for depression. And it's such a wide spectrum of signs and symptoms that I would need shows and shows and shows to go through all facets of this in terms of the other things that are associated with it. Now, what if you find that you've got depression? What would you do? What would you do? Would you decide to take medication, or what else would you think about doing to try and help yourself? And most people get better without treatment, actually, with depression. Most people do. However, and this is where we've got to think about it, it takes longer. It could take about several months. And the average length of an episode of depression is about 6 to 8 months. Meanwhile, living with depression can be difficult and distressing, and also for your family and friends. Your relationships can be affected, your employment can be affected, it can have an impact on others as well. So it's really important that, you know, we think about how as a family we can all come together. If you've got family or friends as well, you know, not everybody has family members and friends as well, how you can help your loved ones. So what I would like you to do is think about how you can reach out, and even if it's 10 minutes a day that you phone up someone who is suffering from depression, or even send them a text message, how are you doing, just thinking about you, I hope you're well, that often means quite a lot and prevents prevents the influx of these feelings that a person is isolated. And that's one of the things that we really do have to negotiate when we're feeling depressed as well. So what you've got to do in terms of, if you've got mild depression, there are some things that can be looked at. Now, the following are commonly used treatment programs, and we can talk about that. And I'm also going to talk a little bit about the services in Peterborough as well, because this is where it's all happening. A lot of people say there's not enough happening in Peterborough. It's true that waiting lists for things like counselling and to see a medic or a clinician is horrendously long. However, there are absolutely heaps of self-help resources, and very good ones out there. So this is what I'm going to make you aware of. Now, mild depression, the treatment options are, they're used for people with long-standing, not quite fully depressed, but mild depression, that's shown really no signs of improving. And some people prefer one type of treatment to another. So personal preference really does count over here in those people that suffer from mild depression. And it's very good to discuss these treatment options with your doctor. So there are books, there are CDs that can help you understand and combat depression. And these are known as CBT, or cognitive behavioural therapy. And I'm going to cut to the chase and actually tell you about resources that you can undertake to have CBT. Now, there are apps on your phone that you can have in the way of mindfulness and CBT. And mindfulness as well is very good. But when we're talking about CBT, there are computer-based CBT programs, and one of them is called Mood Juice, that was developed by the University of Newcastle, and it's all very good. You've got to read through it, but one of my actual favourites that I've given and advised to university students, for example, they go to university, they don't realise what's hit them. You know, there's a new way of life. They can't negotiate the stress. People often think, and youngsters often think, that once they've done their A-levels, they're packing up, going to university, it's going to be a life that's wonderful and free, and you've got everything going for you. Well, actually, it can be quite stressful with all of the essays and the deadlines and the end-of-year assignments that you have to meet. And I am consulting now more and more with university students, and youth and mental health is something that I am inherently passionate about. So I signpost them when they can't see me to cognitive behavioural therapy that takes place on the computer. And one of the resources that they can undertake is something known as Mood Gym. And Mood Gym is a course that was devised by the University of Brisbane, and all you've got to do is commit to it. Once upon a time it used to be free. It's Australian, as you can imagine from the word Brisbane, but I think now you've got to pay a very small fee, somewhere in the way of I think $6 to $12, if the price hasn't increased since then. And you've got to commit to it, and you can take your own time completing it, but it's very, very good. And I've had feedback from students that they feel so much more better after doing that course. And what does cognitive behavioural therapy do? Now, cognitive behavioural therapy aims to see what type of a mindset you are subjected to at that present time, and attempts to take you out of that mindset and put you somewhere else. So that is one thing. I've got a comment here from Sister Shabina. Ameen, summa ameen to all the du'as. Jazakallah khairan, sister. And Shaista Parveen, ameen. Brother Naveed Ahmed, very nice listening to you, sister. Thank you very much. It's lovely having you all on. Thank you so much. And I've got a question that's just popped up actually on my phone from Councillor Amjad Iqbal. Could you please give us a little bit more information about mindfulness? Definitely, Mr. Iqbal, Councillor Amjad Iqbal, will definitely give you information on that. And thank you very much for asking that question. That's a very, very important question, because part of what I do is I speak about mindfulness a lot to my patients. I give mindfulness a lot to my patients. So I'm going to talk to you a little bit about mindfulness. I practice mindfulness. I think it's so important to be able to practice it. So you can have group-based CBT as well, but computer-based CBT is what I've told you about with regards to Mood Gym. Then you can have group-based peer support as well. So it's only an option for people with depression who have an ongoing physical problem, and it usually lasts for 8 to 12 weeks as well. Now let's talk a little bit about mindfulness before we talk about depressant medicines, antidepressant medications. Mindfulness. Now mindfulness is the ability, it's a type of therapy, it's the ability to be able to relax and empty your mind of thoughts and, as it were, recharge your batteries. I'm going to use very layman terms simply because of the fact that this is information for you to understand and grasp. And mindfulness can be done anywhere. As long as you have a technique or as long as you have a resource, you can sit down and undertake mindfulness for 10 minutes at a time. You can do it in the office, you can do it at your lunch break, you can do it at home, sitting at home. And it's always good to take out 10 minutes and practice 10 minutes of mindfulness during your working day, especially if you have a stressful schedule, much like I. And if you do have practice mindfulness, it's good for your emotional well-being. And the resources that I love to use, one's called Headspace, which is an app that can be obtained from your smartphone, and the other one that you can get is known as Calm. And I like Calm. I'll tell you why I like Calm, because Calm has a lot of resources. Now Calm has meditation, it has mindfulness, it has mindfulness that is tailored to specific emotional problems. So we're looking at, for example, anxiety, or we're looking at exam stress, or we're looking at bereavement, or we're looking at lack of sleep, or we're looking at an overactive routine. And Calm tends to give you your daily dose of calm. And that's how it comes in that program. You've got to pay a subscription, but it is really worth it. And it also has sleep techniques as well. So the sleep techniques in Calm are a very soothing voice at the other end. It's a female voice, and I find her very soothing. And often, when at the end of a busy working day, it's difficult to switch off, and you just need to switch off and eliminate the external world around you. I've often used the app called Calm, and honestly, whoever she is, she makes me sleep like a baby. So do try it, because it is really very, very useful indeed, and I encourage people to use it as well. Now, people have this stigma around medication and why they should take it. What are the myths surrounding medication that we need to talk about? So some people say, I'm told that medication for depression is addictive. Not in every case. A lot of people say, once you're on medication, you can't come off it. That is not true. And there are just general fears surrounding antidepressant medication, and this is so important to talk about because I often see depression and stress and anxiety as all very accumulative if you're unable to negotiate it on a personal level. And what happens is that you have these little receptors in your brain that can normally filter out the negative and keep a balance of the positive through hormones and chemicals in your body. And again, it's very simplistic language. So, once you grow up and you're going through the regular stresses that the general population would, with work, family, finances that give you the regular stress, if it becomes accumulative or goes above the threshold with which you can negotiate it, it can be difficult sometimes to control that aspect and to bounce back again. And think of your receptors in your brain as little shock absorbers. And what I usually tell my patients is that sometimes over time, just like the shock absorbers in a car, they can become clogged up with these negative thoughts that enter your mind. And as a result, what happens is it's difficult to clean out those receptors because you're unable to keep that balance in check with positive thoughts versus negative thoughts. And those little receptors in your brain become clogged up and stay negative permanently. So, you need medications to clear out those shock absorbers. And it takes time to clean them out. So, the guidance, NICE guidance, the National Institute of Clinical Excellence, states that anybody that has been diagnosed with a first episode of depression that merits or needs antidepressant medication takes it for 6 months at least. And why is that? It's because if you stop such medication, you can have a sort of a bounce back of those symptoms that you were feeling, and it can be difficult to treat. And anybody that finds themselves coming off medication the first time and then having to go on it a second time during some point in their life will have to stay on it for 2 years. So there are side effects with medications. I think that it's important to be blatantly honest with your patients who suffer from depression, because if there's anything that a patient wants when they're speaking to their doctor, when they're feeling depressed, it is time, it is sympathy, it is compassion, and being honest. And I'm usually blatantly honest with my patients, and I usually say, well, actually, now we've decided that you'd like to embark upon a course of medication, you're going to start feeling crap before you get better. And it's true, some don't, but it's good to put that perspective across so that people know what to expect. And what usually happens is they will feel worse before they get better. And how long will they feel worse for? In some cases, you can feel worse for up to about 2 to 3 weeks. In other cases, I usually say to patients that it will take you about 4 to 5 weeks for the medications to kick in properly. What are the sensations of feeling worse before you get better? You can have abdominal symptoms. You can start feeling sick. You can feel tired, lethargic. Some people can feel drowsy. Some people might not have the get up and go in them. Some people can feel jittery and more anxious and have an extremely short patience span when they start these medications. And I can tell you, I've been on them before. And for me personally, it took around 2 weeks. I felt very jittery. And I can remember we went out to a restaurant, my family and I, we went to a restaurant, and all of a sudden I couldn't sit there for very long, and I had to ask my husband that I wanted to leave. So these are the type of things to expect. And one day I woke up and I thought, oh, I think I can do today. And for me, that was a good place to start. So it's really important to give a realistic perspective of how medications are going to work, how long they're going to work for, and when you expect to see the results. So you start feeling worse before you feel better. Nobody expects you to be bouncing off the walls and be happy. However, what will happen is that you will see some side effects, but you stick to your guns, and that is why most GPs will see their patients 2 weeks after they've started the medication again, so that they can get slowly into the routine of taking the medication. And then your GP sees you between 6 to 12 weeks later to establish how you are on the medications, if your dose needs nudging up a little bit because you've seen an improvement but it's not quite there yet. And from there on, you are advised if you need any extra resources or extra counselling, which everybody is different, they may do, then it's important to try and ascertain that with your GP, because every single patient is different. Now, let's talk about Ramadan and mental health medications. So, Ramadan to Muslims is a very important religious period in the Islamic calendar, and it requires healthy adults to fast during the daylight hours. Now, medicines usually work best when the level of medicine within your body and brain is kept at steady levels, especially with medications to do with your mental health. And when Ramadan occurs in summer like it is now, the long hours of daylight may interfere with you taking your medications. So especially if you take them up to 2, 3 or 4 times a day. Now, if that is the case, if you have a severe mental health problem, it is not incumbent upon you to fast. And this guidance is given in the Holy Quran as well. Now, it's very important that before you decide on exempting yourself from fasting, seek some guidance from your local imam or Muslim chaplain, along with your GP, just like I spoke about in diabetes. Now, what we should do. Now, for example, which medicines are okay to take during Ramadan? Medicines that are given by any other means, such as through the skin, the muscles, the veins, or the joints. Those are okay to take. You will not break your fast and you can continue to fast. Now, ear drops are okay, and eye drops, you may have remembered the eye drops I told you, that if you put your finger on the little round ball on the inner part of your eye and then put your drops in, that will prevent the drops from going down to the back of your nose and into the throat. And it's also okay to take your patches as well. Now, smoking it's an ideal time to take it, but what I would advise you to do is you should have a list of all of your medication, your mental health medications as well. Write down what type of medication it is. Is it a tablet or is it an injection? There are lots of mental health medications that are given via injection into the muscle. That shouldn't be a problem for you. And if you're taking your medication once a day, the best time to take it would be at the suhoor meal time. Okay? So I hope you're able to understand that you take it at the suhoor meal time. And if you take your medication twice a day, it would be better to take your medication before the dawn meal and after you break your fast as well, just with your meal. If you are to take your medication 3 times a day, then what you need to do, so if you take them every 3 times a day, you can, very few mental health medications, first of all, must be taken 3 or 4 times a day. But there is a medication that I know of known as quetiapine that must be taken 3 to 4 times a day usually. And you may be able to move one of the daytime doses to either before the dawn at suhoor or after sunset. Get some specialist advice regarding this, but you can usually do it just to move your daytime dose. So those during the day doses, like at 6 o'clock or at 12 o'clock or at 4 o'clock, what is the best time to take them? And you can also speak to your local pharmacist. So there are patches that can be given during Ramadan that can be converted from your medications. So the patches that you can get are methylphenidate plain tablets. You can switch to once a day preparations. So quetiapine, as we were talking about, it can also be switched to an extra long or a modified release version as well. Rivastigmine is a medication that is often given to patients who sometimes have dementia, and they can be converted to patches during Ramadan as well. Lithium can only be given once a day. Lithium is given in patients who have bipolar disorder. So sometimes it's good for them to have lithium once a day, but they have to take plenty of fluids during the non-fasting hours. And know what to do if you think you have signs of lithium toxicity, which is, again, something quite serious. And sodium valproate. Important to take advice on sodium valproate from your specialist. Normally, we see that sodium valproate is given 2 or 3 times a day, and there may be other medications that can be considered as daytime alternatives during the month of Ramadan if you're taking sodium valproate. Now, venlafaxine, you can also get, if you're taking venlafaxine twice a day, you can get modified release versions, which are quite good, and that can be changed. And also, there are some antipsychotics that are available as injections as well. It's very important, whatever you do, you see your own GP before you embark upon any other type of medication regime. And I've got this fact sheet which is wonderful, and it's from a website that is known as choiceandmedication.org and speaks about a handy fact sheet during Ramadan. So this is something that I can put the link up about, and in the meantime you can have a look at it. And you know, it's been so wonderful speaking to you. I'm so happy I was able to keep you company, or you've allowed me to keep you company on the last Jummah of this beloved month of Ramadan. And I know that it's pulling at my heartstrings that this month we're about to say farewell to it. And let's all come together and make dua for all of our brothers and sisters, and anybody that we know, whether they're Muslim, non-Muslim, faith or no faith, that if they're unwell or they're not in a good place emotionally, let's all make dua for them, because that's the beauty of our religion, to build bridges and to send out messages of hope, peace and compassion. And inshallah you'll see me on my regular Wednesday slot, inshallah, from next week onwards on the Body, Health and Mind show. Brothers and sisters, thank you very much for your time. And
stay tuned to Salaam Radio after this short ad break.